Dr. Sheldon Horowitz, and welcome to NCLD's Ask the Expert series. Today, what I'd like to do is share a little bit of information about executive function. We've got lots of questions coming in all the time about executive function and how it relates to children with learning disabilities. So what I'd like to do is just share a little bit of an overview. When we talk about executive function, it means sort of what it sounds like. Being able to orchestrate your time, being able to organize yourself so that you can accomplish a series of tasks. The first thing that you need to do when you engage in executive function activities, and we all do these kinds of things all the time, is you need to activate your thinking. You need to sort of focus on what it is that you have as a task at hand. You then need to orchestrate all of the different kinds of things you need to do to get the job done. You need to self-monitor as you're doing those kinds of things so that you know how well you're doing. You need to evaluate the outcome to that point and then looking forward. And you need to make adaptations. You need to change strategies. You need to approach it in a little bit of a different way and do some self-correcting. So some of the features when we talk about executive function that go into executive functioning, and again, we're all doing these things all the time, but students with learning disabilities often struggle in this particular area, is that you need to use past knowledge. You need to be able to retrieve what it is that you know that's worked in the past, and you need to be able to say, okay, here's the ballpark within which I have to then think about the task at hand. You also need to note the details of the current situation. You need to ask yourself, for example, what is it that the assignment is asking me to do? What particular questions do I need to answer? How long does this particular set of activities need to be? What is the final product going to look like? How am I going to get from here to there? In terms of executive function, students with learning disabilities also have to think about, well, how they feel about the assignment. What kind of motivation do they bring to the task? If it's something that they just don't really want to do, they're going to look for ways, as we all do, not to do the work. But also, what assumptions can we make? And what expectations do they have about, for example, how they're going to be graded? Those are really important executive function steps in the process of organizing to prepare for doing all kinds of executive function tasks. Students with learning disabilities should also think, and we all need to think, about evaluating the risk when we engage in a particular activity. So, for example, will I have an opportunity to self-correct? Will I be able to do it again? If what I've chosen to do doesn't work, what are my options? Along the way, individuals using executive functions also have to be familiar with repair strategies, ways to make mid-course corrections. And this is a particular area where students with learning disabilities often have a huge amount of difficulty. They get stuck. They do something the way they think it will work, and if it doesn't work out for them, they have difficulty switching gears and adjusting and trying something different. Often, students with learning disabilities have difficulties with delayed gratification. They try something, they want it to be done first time, they want it to be right, and it's difficult for them to then step back and evaluate from a distance. They often have difficulty making plans, thinking about what they need to do first, second, and third, what equipment they need, who they need to be able to check in with along the process, when things need to get done on a timeline. They need to keep track of time, which is also something that students with learning disabilities often struggle with. And not least, students with learning disabilities, as they're engaging in executive function tasks, need to be able to, and often struggle in ways that prevent them from asking for help. Going to a teacher, going to a colleague, going to a peer, going to a mentor, going to a parent, and saying, can you help me walk through this? What do I need to be able to do this successfully? For more information about learning disabilities, about executive function as they relate to learning disabilities, please be sure to visit our website, www.LD.org. I encourage you also to follow us on Facebook, facebook.com/LD.org, and follow us on Twitter, Twitter @LD.org.